The core issue is clear. Child nutrition in Bangladesh is stagnating while wasting remains stubbornly high and dietary diversity stays disappointingly low. But here's where it gets controversial. Is progress happening at all, or are we simply measuring the same stubborn problems with a different lens? 5-year-old Sumaiya, who should be sprinting towards school with her peers, is instead confined to a small room in Dhaka's Bagunbari slum. She is frequently ill and severely undernourished, a stark reflection of a daily struggle to afford even the basics. Her family's finances are stretched thin by rent and the needs of 3 children, leaving little room for meals beyond rice and vegetables. Meat, fish, milk, and fruit are rare or absent from their plates. This is far from an isolated case. The Bangladesh Multiple Indicator Cluster Survey, MICS, 2025, released by the Bangladesh Bureau of Statistics, BBS, paints a troubling national picture. Wasting among children under 5 has risen to 12.5% from 9.8%, signaling a sharp increase in acute malnutrition. Underweight prevalence remains high at 23%. Disturbingly, only 35% of children aged 6 to 23 months meet the minimum recommended variety of foods, a key factor for growth and immunity. Wasting is defined as being too thin for height and represents one of the most dangerous forms of undernutrition. Moderate to severe wasting significantly heightens the risk of death without prompt treatment. Stunting, another consequence of poor nutrition and recurrent infection, reflects impaired growth and development. While stunting shows a positive trend, down to 24% nationally, it remains a major concern, and nearly 1 in 4 Bangladeshi children under 5 are still underweight due to a combination of wasting, stunting, and ongoing food insecurity. The government is urged by the BBS to intensify both the prevention and treatment of wasting, while continuing efforts to reduce stunting through stronger food systems, better primary healthcare, and improved water, sanitation, and hygiene, WASH, interventions. Experts warn about long-term consequences. Dr. Khaleda Islam, a professor at the Institute of Nutrition and Food Science, describes the MICS findings as a mixed bag. Some progress exists, but many children lack dietary diversity, often not consuming even 5 different foods daily. Without broad dietary variety, meaningful improvements in nutrition are unlikely. She cautions that rising wasting will hamper children's physical and cognitive development, potentially preventing them from reaching age-appropriate milestones. For the first time, MICS includes anemia testing, revealing high rates among children aged 12 to 59 months and pregnant women, pointing to widespread micronutrient deficiencies. Dr. Islam notes that iron deficiency anemia has long been present, and micronutrient-related anemias, including vitamins, are very common. Maternal anemia also increases the risk of low birth weight babies, who are more susceptible to pneumonia, diarrhea, and growth impairment. Rising economic pressures, both global and domestic, have made nutritious foods less affordable for low-income families. People may eat enough to feel full but still miss essential nutrients and dietary variety. Authorities are urged to weave the BBS findings into both public and private nutrition programs, with a strong emphasis on expanding food diversity. Maternal health remains central. Professor Dr. Firdousi Begum, former president of the Obstetrical and Gynecological Society of Bangladesh, emphasizes correcting anemia before and during pregnancy. She notes that maternal anemia raises the risk of postpartum hemorrhage and low birth weight babies, which in turn carry higher early death risks. Ensuring at least 4 antenatal checkups can help detect and address these issues early, preventing problems from escalating. Regional disparities are stark, with Sylhet Division identified as the worst for child nutrition. In Sylhet, stunting among under 5 children stands at 32%, and wasting at 14%, both above national averages. By comparison, Khulna records the lowest stunting rate at 21%, and Dhaka the lowest wasting rate at 11%. Across the country, only 74% of children aged 6 to 23 months receive the minimum daily meals, and even fewer meet dietary diversity, 35%, or minimum acceptable diet standards, 30%. The data also show that children from rural, low-income, and low-education households are far less likely to meet dietary standards. Yet even among urban, wealthier, and better-educated families, fewer than half of children achieve adequate dietary diversity, highlighting a nationwide gap in nutritional awareness and practice. This is not just a rural problem, it's a nationwide challenge demanding widespread education, resources, and policy action.